Welcome everyone to today's webinar, Urban and Transport Planning Pathways to Carbon Neutral, Livable and Healthy Cities. My name is Claire Walter and I'm a member of the Climate and Energy College, which is based at the University of Melbourne and hosting today's webinar. I'm also a PhD candidate analysing air pollution research and policy in Australia through the University of Queensland. Please join me in acknowledging the traditional owners of the various lands from which we're joining this webinar and in paying our respects to their elders past, present and emerging. Today's webinar is being recorded and the video will be available on the college website by tomorrow. Please submit questions during the presentation using the Q&A function, which is at the bottom of the screen. You can also upvote other people's questions using the Q&A feature. You're also invited to use the chat feature, but please don't post your questions on this as we'll only be monitoring the Q&A channel at the end of the presentation where you'll get a chance to have some of the questions answered. So I'd like to now introduce Professor Mark Nieuwenhuijsen. Mark is a world-leading expert in environmental exposure assessment, epidemiology, health risk and impact assessment, with a strong interest in healthy urban living. Mark is a research professor at the Barcelona Institute for Global Health, where he is also the director of the Air Pollution and Urban Environment Program, and the director of the Urban Planning, Environment and Health Initiative. Mark is also the editor-in-chief of Environment International, and is the president of the International Society for Environmental Epidemiology. He's edited several books, co-authored 35 book chapters, and co-authored more than 450 peer-reviewed journal articles. In 2018, Mark was awarded the International Society for Environmental Epidemiology's John Goldsmith Award for outstanding contributions to environmental epidemiology. And in both 2018 and 2019, he was among the 1% most cited scientists in the world. So without further ado, I'll leave you to Mark. Thank you.
Thanks, Claire. Good morning to the people from here in Europe and good afternoon for people in Melbourne. Normally I come over to Melbourne a couple of times per year, but this year it will be difficult, I think, to come back, and I will miss it. And I'm just seeing, oops, what happened to my screen? Oh no. I've got a little problem here getting things back. I hope you all can see now my screen. The problem is I've got two screens and it always jumps from one to the other. Anyway, it's lovely to be here. That's what I said. Normally I come over to Melbourne. Unfortunately, I can't come over, so I guess I do it by webinar. But I'm hoping to be back soon. But I have the idea that it may take a while actually before I'm back. So today I will want to be talking about some of the work that's ongoing around urban and transport planning and how this may make cities healthier, but also at the same time carbon neutral and livable. And I first would like to start off with, though, with, oh, what is happening now? My presentation is not going forward. So to putting things into a context and then go through the COVID, what's going on, what I think, what is the current situation and what may help making cities actually healthier. As many of you may know already, I mean, we've got many deaths each year due to air pollution in the world. A kind of a conservative estimate for outdoor air pollution is about 4 million. A more probably realistic estimate will be twice as much as that. At the same time, we've got many deaths, and more than 3 million premature deaths each year due to physical activity. And we got more than 1 million deaths due to traffic fatalities, particularly in low and middle income countries, what we have. At the same time, we've got the climate crisis, we still have population growth and aging, and we still got urbanization going on, with soon 70% of the world population living in cities. Cities are very attractive for people, and Also, they provide many jobs, and that's where we're going. As we're all aware, we've got the COVID crisis at the moment, a kind of big surprise to all of us, and unfortunately we all suffer from this. Some of the prevention measures that seem to be quite effective is hygiene, hand washing, particularly also using physical distancing, distance, and then also self-isolation when ill. And what we've seen is that, I mean, at the moment in Melbourne, you have quite severe lockdown measures, what we had here in Barcelona, but we see light to severe lockdown measures all over the place going on, trying to stop the spread of the virus. Now, it has some impacts. I got here an example of what was happening in Barcelona, Catalonia. We saw that there was, this was from March, around March, we saw reduced physical activity by about 40%. We saw an increase in poor mental health. Many people are suffering by an increase by 20%, also an increase in domestic violence. So these are some of the negative impacts. Some of the more positive was that we had reduced traffic, and what led to reduced air pollution levels up to 70 to 90%. Also a reduction of noise, but unfortunately also a reduction in green space visits because we couldn't go out. So there was a mixed bag of beneficial and detrimental impacts. But for me, as particularly around cities where we know that there are hotspots of air pollution, it also provided evidence that we actually can reduce air pollution levels in cities. And that, you know, before it was always, is it actually possible? And many people said it isn't, but it was actually possible to do this. Now, if you want to make a change for anything, then there are a number of prerequisites. First of all, you need a crisis, you need the knowledge for how to solve this, you need the technology, you need partnership, vision, and leadership, according to Lucia Rice. And I think what we have at the moment is a crisis, the COVID crisis. And I think this may be giving us time to think about which direction we would like to take with our cities. We see that changes are possible. And the question is, you know, can we keep the changes for the long time? And this comes in, you know, do we have the knowledge to make the changes? Is there technology available? And then also some of the other things. And that's what I would like to talk a little bit about. As many of you know, that there is a relationship between how you design a city, or what is the urban model, how people behave, and how this leads to environmental exposures and lifestyle factors, what may lead to morbidity or mortality. So, for example, if you design a city for cars, I mean, particularly in the US, we see that many cities are designed for cars to get around. You get a lot of people using the car, you get higher air pollution levels, more noise, you get heat island effect because of the infrastructure that's needed for the car. You get more stress, less social contact, more physical activity, less physical activity due to car use, and that leads to morbidity and mortality. On the other side, if you design a city, say, for cycling, you get more people to cycle if you put in more cycling infrastructure. It gives less air pollution, noise, you need less space, or less the heat island effects, fewer heat island effects. Also, you know, cyclists are less stressed, they have more social contacts, they have more physical activity, so lower morbidity and mortality. We've seen here, for example, in Barcelona, we did a health impact assessment, and we saw that there are almost 3,000 premature deaths each year due to suboptimal urban and transport planning. That's about 20% of the overall mortality. If you break it down, this was some of the numbers what we got, was that over 1,000 deaths were due to lack of physical activity, because we know that many people lack or get enough physical activity, you know, the 150 minutes of moderate and vigorous physical activity each year. And then also over 600 premature deaths were due to air pollution, a similar number to noise exposure. And then we have also here in Barcelona the heat island effects, so almost 400 premature deaths. And then also we have lack of green space, what also leads to premature death. So altogether around 3,000, but normally what is counted for traffic, for urban, particularly for transport planning, is how many traffic injury deaths there are, and there are only 30. So the actually real burden is about 100 times than we normally think about for what is the burden of transport. And it's not so different in many other cities when you do similar analysis. Now, I think probably Barcelona is at the higher end, particularly if you look at more Western European cities or Australian cities or American cities. But, you know, there's still a considerable burden, which you actually see in many cities. So one of the things is, what we're looking for with the current COVID crisis is what are some of the solutions for this? You know, now that we're living in a 1.5 meter distance society. And here I've given some of the transport modes that are generally being used, the main ones, and the impacts on the spread of the virus, the impact on how much public space it takes up, the health benefits and the environmental impacts, just to give some kind of idea what is the impact. For example, here, if you look at the car, a lot of people use the car. Now, I know in Melbourne, it's the predominant mode of transport, so it's probably not so much changed, but like here in Barcelona, it's only 25% of trips that are done by cars. The spread of the virus is fairly low, and that's why people like to go by car. But a car takes up a lot of public space that can be used in a much better way. Here in Barcelona, 60% of public space is used by the car, while it's only 25% of the mode share. Also, it got low health benefits. You know, it doesn't give you any physical activity, and it's got large environmental impacts that are often not taken into account into the cost. On the other side, public transport, the perception is generally that the COVID transmission risk is fairly high, although with good measures, actually, it's lower. Doesn't take so much public space. It's got some health benefits because people walk a little bit as well, and it's got medium environmental impacts. On the other side, if you look at the active transport modes like walking and cycling, the risk for transmission of COVID is very low. It doesn't take up much public space compared to the others. It's got many health benefits because people are active, and also the environmental impacts are fairly low. So this is kind of the mode what we should be promoting. I see that I've got a lot of sun coming from the back. I'm sorry about that. I can't move my computer. So a number of cities have chosen to start changing what's happening in the cities and trying to get people from the car to actually walking and cycling. So, for example, I'll give you a number of examples from European cities. For Paris wants to keep the cars out after the lockdown. London is going to make many parts car-free, is what they're saying. Milan announces also a scheme to get more people to cycle and fewer people to get around by car. So, you know, there are things going on, but are they actually going fast enough, and are we doing the right things? So for me, I'm looking at a bigger picture, what we need to be doing. And I'm going to take you through some examples here, what I think what we need to be looking at, and also show you some of the health benefits of those. At the same time, there are also benefits, of course, for livability and for sustainability. So the things what I'll be looking at are land use changes, the reduction of car dependency, and the move towards public and active transportation, and also greening of cities. In this way, greening of cities is putting in more trees. So one of the nice studies that were published now already almost 5 years ago was by Mark Stevenson from Melbourne, led by Mark Stevenson, where they looked at 6 different cities around the world. And they asked themselves that if we make the cities a bit more compact, because we know that sprawled cities have a large environmental impact and very good for health. What if we make the cities more compact, go more to a compact city? what are the health benefits of this? That in a compact city, what means is that you increase the density, you reduce the distance between home and work, for example, and you increase the diversity. So they looked at about 30% change in this. They took quite diverse cities with different mode of transport, or the distribution of mode of transport is what you can see. Here you can see Melbourne, 85% use of the car. On the other side, if you look at a city like Delhi, it's only 20%. Overall, they found that by making the city more compact, they could save between 400 and 800 dalis per 100,000 people annually. So there were quite substantial health benefits. And one dali is if you lose 1 year of life, or you live some part of your life with disease, you can calculate that. And we use a dali to put everything together. But you know, it shows that there's quite considerable benefits by actually making this cities more compact. I mean, if you want to look more in detail what's going on, you can have a look at the paper. Here's another example from Barcelona. Now, Barcelona is a very compact city. And so in a way it should be good if you look at Mark Stevenson's study. But the problem is that for us it's quite compact, but that many of the streets that were originally designed as providing a lot of fresh air by Ildefonso Da 200 years ago, you wanted to have wide streets so people had fresh air, were actually taken up in the 60s by cars. So we have a very high traffic density in Barcelona. And that causes a lot of air pollution, noise, also heat island effects. And Ildefonso Da at the time wanted to have a lot of green space in the city. And you see here the city blocks. In the middle of the blocks, the idea was they would put in parks, but they were all filtered by other things, so no green space. So Barcelona is a compact city, but not with the right use of the city. But at the moment, there are ideas of going back to the original idea for Ildefonso Da. And this is done through the idea of a superblock. So currently, what you can see on the left, what is the current situation? Normally we have one-way roads going left or right or up and down. Everyone can go. The idea of a superblock is to cut off 4 junctions, these 4 junctions that cars or motorized traffic can't go through anymore. Only walking and walkers and cyclists can go through here, and introduce more green space. The idea is to do this all over Barcelona, so introduce 500 superblocks. Now, as you can imagine, it's much nicer to live in this area than in this area. So there is some people that are not completely happy with this kind of idea. But overall, I mean, it would be quite beneficial. So this is one of the super blocks. So far, there are only 3. So this was San Antonio. The top one was before, and here the bottom one, you can see what it's after. It's got many advantages. There's a car reduction overall, reduction in air pollution and noise, increase in green space, and a reduction of surface temperature according to modeling studies that have been carried out. We looked at what would be the health benefits if all the 500 super blocks were introduced. And we found that you could save almost 700 premature deaths each year if we introduced the superblock, so a new use of our current urban space. The biggest benefits come from reduction in air pollution, the smallest of physical activity, because we were very conservative in the physical activity, and we only looked at changes that people would make to going to work, and not how much physical activity it would produce when people are actually in their own neighborhood. Another example, I think what is very nice, what is being introduced, another model, is the 15-minute city. And this is being encouraged or being supported by the mayor, Ana Hidalgo, in Paris, where the idea is that everything, what you, all your activities, your work, sports, your shops, are within 50 minutes of your home. So this also would reduce quite a lot of travel. I mean, I think it's a brilliant idea, except it's probably very hard to implement in a way. As many of you know, you live a long way away from your work, and you know, some people need to commute an hour and a half to get into work, and trying to reduce it to 50 minutes is going to be requiring major changes in where we live and how we get around. But I think it's something definitely to aim for, and it would make your life much more pleasant. Many people don't like the long commute, but you know, it would be also requiring that also where people would live or choose to live, and also with housing, etc. The other one is kind of urban model, what has been promoted, are car-free cities. We wrote about it not so long ago. And for example, there are some examples for this. I mean, if you go to Vauban in Freiburg, there's a whole neighborhood that's actually car-free. So there are no cars allowed there. The neighborhood is full of sustainable housing, lots of green space. And it's actually a wonderful place to be around. So again, I mean, it's a different urban model that is worth promoting. Although it also asks for quite dramatic changes in how we perceive our cities. Now, as many of you know, our current cities are still dominated by cars, and rather than changing the urban model, people say, if we just change the transport system. And for example, what is being done at the moment is the introduction, what's highly promoted by the introduction by electric cars, mainly by the car companies, because they say, you know, if they sell a fuel-based car, fossil fuel-based car, or an electric car, it's still a car, it's something that they can sell. So they are putting all their money onto the electric car. But the electric car is not the solution, if you ask me, because, you know, it's still a car. It takes up a lot of space in cities, a lot of the infrastructure. It produces less air pollution, a bit less noise, of course, but also there's still air pollution from non-tailpipe emissions, from the tires, from the brakes, etc. And also people don't get physical activity. So it's not really the solution what you would have. I would say trying to get people out of the car and get them to, for example, cycle in this way. It's a much more better form of getting around. And also, you know, we have to realize that many of the trips that are taken by car nowadays are fairly short. I mean, less than 5 kilometers. They can be easily replaced by the bicycle. But of course, to do this, you need to have a safe cycling infrastructure. Also, for the longer trips, I mean, normally the bicycle may be too difficult, or when it's hilly. But fortunately, we've got nowadays also electric bicycles. Bicycle cycling has many benefits. It reduces premature mortality. It combines the transport with the gym. Many people don't have time to go to the gym, but they still need physical activity. So if you can build it into your life by cycling to work, you don't need to go to the gym. It's less air pollution, less noise, zero CO2 emissions. It takes up much less space than the car. And what we know is also that cyclists are happier than, for example, car drivers. We also know that the benefits of physical activity well outweigh any risk of air pollution or accidents. Many people are worried about accidents, but actually they're very small. In many cities, we've seen changes by introduction of the bike sharing system, what got a lot of people to cycle. You know, with more success in some cities than others. I mean, here in Barcelona, it's been a real game changer, but I know for other cities it hasn't been so successful. And as what I said, you know, if you have a very hilly area or you've got a lot of wind, an electric bike is actually great to get around. But they're becoming now more affordable, and the prices really have gone down. And in many places, you see a lot of use of them. Also, they're quite good for the the older adult population that has sometimes some difficulty cycling as well. One of my favorite pictures here is Utrecht in the Netherlands. They do a lot to stimulate cycling. As you can see here, the cycling pathway is completely full. You can't see a car inside. You can see a bus in the distance. But it's, you know, more kind of what I think what we should be aiming for in our cities. To do that, you need to have safe cycling infrastructure. As what I said, people don't want to cycle if it's not safe to cycle, and only one accident or two accidents actually reduce the number of people cycling. We did a study where we looked at 167 cities in Europe. What is the relationship between the cycling available in safe cycling infrastructure and the percentage mode share of cycling? What we found that up to about 25% of mode share of cycling, there's almost a linear relationship between, you know, how much the availability of safe cycling infrastructure and the percentage of people cycling. Over that it breaks down, and that's probably because other factors become more important. But it shows how important it is actually to give safe cycling, to provide safe cycling infrastructure to get people cycling. We also estimated that if in this 167 cities, well, there's a population of 75 million, if the mode share would go up to 25%, we could save over 10,000 premature deaths each year in these particular cities. So, I mean, there would be a very large impact on health. As what I said, health benefits from physical activity well outweigh the risk of traffic accidents and air pollution. We did a review about 5 years ago where we looked at all the different studies looking at this, and I think we found a benefit risk ratio of about 60 for this. Now, the other thing to think of to make cities greener, but also more carbon neutral, is greening of cities. Often people think about this as for greening, having a nice park. And I know, for example, in Melbourne, there are many nice parks around. When I go to Melbourne, I love Fitzroy Gardens, get there a walk often, absolutely beautiful. But of course, I mean, other green what you can have is just in the street. I mean, this is Poblenou in Barcelona. It's the Ramblas of Poblenou with trees around. Also in this Ramblas, no cars are allowed as such, so the cycling paths at the side. So it's a wonderful neighborhood actually to be. Greening cities has many health benefits. We know longer life expectancy, fewer mental health problems, better cognitive function, better both in the children and the elderly, what we've seen so far, better mood, healthier babies. It mitigates air pollution, heat and noise levels. We've seen a number of studies on this. It's good for CO2 sequestration. And what we can think of is that replacing roads and parking, the infrastructure that we have cars, with green environments can change an environment that is detrimental to health to something that's beneficial to health, and also promotes sustainability. Michel Kondo recently did a health impact assessment in Philadelphia. At the moment, they have 20% of the city in Philadelphia is covered by trees, and they want to increase that to 30%. So they want to increase the tree cover by about 10% there. There are already some neighborhoods, in particular the richer neighborhoods, that have 30% tree cover, but many of the poorer areas actually don't have 30%. And so she was looking for, you know, how many deaths could we prevent by increasing the tree cover. And what she found was that if they would increase the tree cover to 30%, we could prevent 400 premature deaths each year in Philadelphia. And particularly in the lower socioeconomic status neighborhoods, the benefits were greater than in the higher socioeconomic status neighborhoods, with 244 deaths prevented in the lower socioeconomic status neighborhoods and 159 in the higher socioeconomic status neighborhood. So you can see a real saving. I mean, and this is only looking at premature mortality. Of course, there are many other things that you can look at, mental health, etc., that would bring many other benefits. Now, what we need to make changes is a multi-sectorial approach. We need to bring people together. And, you know, I come from a public health background. I can say what is healthy and to some extent livable, what makes it livable. I can't make the changes. I mean, we need to work, I need to work with urban planners, with transport planners. They actually can make the changes. But often I find they're not so aware of what are the implications of what they do. I mean, urban and transport planners have a huge impact on public health, but probably they don't realize themselves how much the impact actually can be. But also we need to work with the education sector, for example, because, you know, what you see is that many kids are being taken to the school by car. Why? I mean, you ask yourself, it would be much better if they actually would be walking around, walking to school or cycling to school. But yeah, I guess there are some safety issues where they're thinking about, where the parents thinking about, or they take them on the way to work, I mean, drop them off at school. And so we need to be rethinking this, I believe. And then, of course, there are other sectors that you need to get involved as well. What we need is systems approaches. You know, at the moment, we shouldn't, for many cities, I mean, air pollution was high on the agenda to reduce, but it's not only air pollution, it's also noise, heat island effects, green space, physical activity, and of course now also COVID-19. And I think with COVID-19, we need more public space so people can walk around, can do their activities with sufficient distance between them. And I think so to create space for pedestrians, for cycling, we may have to reduce the space that's currently available for motorized transport. Also, I believe that we need to be addressing this in a holistic way in terms that we need to think about health, livability, sustainability, climate change, equity all together. I mean, that a lot of cities at the moment focus on more on sustainability, less so health, but health comes on the agenda. And of course, livability goes together with that. And we shouldn't forget the equity aspect. Unfortunately, there are many inequalities in the cities, and we should be addressing them as well. Now, to make changes, it needs money, and that's often the problem. That, but I don't know what it's in Australia, but like, for example, here in Europe, as part of the COVID, we have a stimulus package as part of that. And also we have the European Green Deal to make Europe sustainable. And there's a lot of money involved with that. And, you know, you can only spend the money once. So I believe that we need to spend it well. We really need to think about it and not only look at economic indicators for spending the money, you know, in terms of how many jobs it will create, but also in terms of sustainability, livability, and health in our society, in particular also in our cities. Can these things actually happen? You know, often people say, oh no, it's very difficult to make changes, but I think it's possible. I mean, here I give you a few examples. This is in Seoul in South Korea. On the left, you see a busy motorway what they had before running through the city. They decided to get rid of it and put in a nice waterway with green space and a small road next to it. A much nicer environment for it to be this. This is in Liverpool, the Alderhay Hospital. On the left side, you see the old hospital here with a park next to it. They asked the children, what would you like to have? How would you like to see the new hospital? They said, we want to have a big park next to it so we can go outside and enjoy the park. So what they did, they built the new hospital. The new hospital is here, covered by green, and the old hospital, they made a park. So they've got much more green space around now in this particular area. So changes are actually possible. So they, you know, car-free. Hamburg says they're going to be car-free by 2034. Many cities have said that they would ban fossil fuels, but going car-free is quite a bit more radical. But hopefully, they actually can do this. That I showed you before the example where already happening. Vauban and Freiburg, wonderful neighborhood actually to be around. If you want to read a bit more about this, recently we published a couple of books. You can see here, if you think they're too expensive, just send me an email. I can send you an e-copy. A lot of these ideas are actually, you find back in these books. And also, most of my talk, what I just talked about, I mean, I published a paper not so long ago that many of the ideas are there in the paper as well. It should be freely accessible, but if you can't find it, send me an email and I can send it to you as well. So many thanks for listening. Hopefully I give you some ideas which direction we should go to. I mean, I'm sure there are many other ideas, other things that we could do, but hopefully it stimulates discussion. Many thanks for listening, and if there are any questions, I'm happy to take them.
Thank you so much, Mark. As interesting as ever and relevant, I think, to us in Melbourne, particularly with regard to the green recovery potential. So for those of you who have submitted questions, we'll be getting you to unmute your audio one by one. I'll name you according to the list that we have. We've got quite a few questions, which means I won't get a chance to ask my own. And if you're not able,
you can ask anytime.
Well, we'll see. Yeah, I can. If you're not able to do so, I'll ask you a question on your behalf. And before you start, please mention your name and affiliation. Thank you. So to begin with, I think we have Mark CPAC.
Hello, Mark.
Hello.
Can you hear me?
Yes, very well.
Fantastic. I've looked at the World Health for sort of a disability by noise, but you have a mortality by noise measure in the early part of your presentation, and I'm very intrigued how that's measured. And I'm taking from the confidence interval that it's an emerging measure, or have you been using it for quite a while?
No. For this particular study, we used the study they conducted in London, a study by Catherine Tonnen, where they looked at noise and all-cause mortality. So the estimate is only based on one study. For our later work, we've been more focusing on cardiovascular disease, cardiovascular mortality as an outcome, coming from a meta-analysis that was not so long ago published, and also based on a study that was done in Switzerland.
Thank you. I'm from University of Technology, Sydney. Thank you.
Thanks, Mark. Happy to discuss more if you want. Send me an email.
Thanks. And the next question we have William McDougall.
Hello. Hello. Can you hear me? Yes,
sure.
Hello, Mark. Yes, I was very interested to hear your presentation. Thank you very much. I'm a independent transport planner based in Victoria, in Australia. I'm interested to really sort of try to unpack how we improve allowances or understanding the benefits of health improvement and getting those properly counted in decision making, particularly, you know, to try to get a better balance in the what I see as usually a trade-off between economic benefit and virtually everything else to do with life, the climate, our health, and all sorts of things like that. Have you had a chance to think about how those things could be addressed?
You know, I don't do so much beyond health, to be honest, and we're trying to put in some more costing, etc. But as you know, aware of, in many appraisal schemes for transport schemes, I mean, the externalities are not being counted. I mean, and I think for a long time for active transportation, for example, the benefits were not given. I mean, what is the benefits of physical activity? And it was more focused on the motorized transport, on cars. So I think bringing these aspects in, I mean, the benefits of active transportation modes, but also the detrimental effects of car use, for example. I mean, it's a big step forward. I don't know what the situation is in Australia when they do a new development, a new transport scheme. I mean, what is being taken into account? More and more, like in Europe, they take the benefits and all the externalities, the risks also into account. But still, I mean, very conservative estimates. And you know, we know that the true cost of car use, for example, is so much higher than what you normally see in this appraisal schemes. But hopefully, we're moving towards that direction. I know, for example, for traffic, for active transport, nowadays many planning proposals, they use the HEAT tool from WHO. It's a very simple tool to look at the benefits of walking and cycling in terms of physical activity, in terms of health, and also economic appraisal. And that's now being accepted as well. And I think that's a step forward, but there's still a lot of work to be done.
Thank you.
The next question we have is from Alison McDonald.
Oh, hi, can you hear me?
We can hear you, but talk a bit louder.
Okay. So I guess places like Melbourne, there seems to be very dominant private car travel still, even in the inner city areas, and there's a lot of pushback against this sort of thing from people who can't really imagine using active transport as their main mode. So just wondering if there's sort of a tipping point or how else we might get around that.
Yeah, no, it's not so easy. I mean, I think unfortunately Melbourne is one of the cities, you know, it's so sprawled. It's so I think it's 100 kilometers wide, no, and whatever. It's an enormous city. I mean that, and it doesn't lend itself so well for public transport or for active transportation, unless you visit a completely different way how we're working. I mean, I think there's still a lot of people commuting to the center of Melbourne. And perhaps with, I don't know what's happening, but here what you see in Europe is that because of the COVID crisis, more people are teleworking. They're working more in their own neighborhood rather than having to commute to their offices. And perhaps that's going to stay. And I don't know if that's the same situation in Melbourne, that you may get more local kind of shared centers where people can work, do some teleworking. What may actually change this? I mean, the other thing is, of course, you know, what is more difficult, trying to bring out the workplaces where people have out to the suburbs. I mean and get people closer to live where they work. But that's not so easy to do. I think, and it takes a very long-term plan. I think the central business district, I mean, that when I go there, it's a wonderful place to walk around, but there are too many cars still. I mean, I would, you know, I gave talks before, and I thought it would be an ideal place to introduce the super blocks in the central business district. Sorry, I don't know actually why there are cars there. I mean, it always surprises me. And I think I wanted a drawing that you could put in 4 super blocks and increase the space for pedestrians and cyclists considerably and reduce the cars there. And that, you know, when one of the things is that I guess there also there's a lot of parking there. When you reduce parking, people have to find other ways to come in, and they can use public transport. And I think that may stimulate this in some way. But yeah, it needs a lot of thinking for a city like Melbourne to make things, to change things, in particular because some of the distances are very long. I mean, I hear people that are driving in for an hour and a half to come to work. I mean, it's you can't do that generally by cycling, and also the public transport links probably are not good enough or not attractive enough for people to take them. I heard also that there are new developments on the outskirts of Melbourne where they just put down housing for 20,000 people or so without any thoughts about public transport or anything. So people have to rely on the private cars. So there's no other way to get around. And you know, then it comes back to planning. I mean, why do you allow this kind of things to happen? I mean, to a minimum, I think what you need to have is you have public transport links to other places. And of course, for example, a good cycling system, cycling infrastructure, pedestrian infrastructure, so people get around there.
Thank you. I'll pass on to Jeff Brown. He's got a comment with regards to health impact analyses, and this also harks back to the earlier comment by William McDougall regarding when our costs outweigh, you know, how do we weigh those up? I'd just like to make one comment before I pass over to Jeff Brown. In Australia, we don't include morbidity impacts in our cost-benefit analyses for major road projects. So we have the highest prevalence of childhood asthma, but we actually don't factor that in terms of the impacts of a road project. So I think not only using HIAs, but perhaps changing our HIAs may be a good strategy. Anyway, I'll open up to Jeff Brown.
Thanks. Yeah, no, I think that's an important comment what you say, because I mean, many HIAs, I mean, they don't include the things that they should include. I mean, I think that's one of the big problems. Jeff, go ahead.
Thanks, Claire. Thanks, Mark. Yeah, it was just to note that HIA does seem to be a really useful tool, and it would be nice to see it used more frequently for projects that are either contested or sort of don't already have an intended health and sustainability outcome. It seems to me, in my limited experience, that HIA is often applied to things which sort of have an explicit health or sustainability outcome as an intention, but not where they could be most useful, i.e. in projects which are contested or have uncertain outcomes. So I'm wondering if you have any thoughts on how we can elevate the use of HIA. In Victoria, for example, I'm not sure if you're aware, but it's an option under the Public Health and Wellbeing Act, but it's not legislated and it's not required. I don't think it's ever been used. So the HIAs that are done are usually funded by local community or local government, and they may not have that much influence.
Yeah, no, I think that's exactly, it's a situation in many countries. I mean, that many countries have legislation for environmental impact assessments, I guess also in Australia, but unfortunately not for health impact assessment. So I think, you know, one thing is trying to get it into the legislation that you need to do it for every project. I mean, it seems to be only natural for me, but or obvious to me, but unfortunately it's not happening. That here in Catalonia, officially we have in the legislation that you should do a health impact assessment, but I'm not sure they're always being done. Now, I'm working with, we have 5 different levels of planning here in Catalonia. It's a small place with a lot of different governance layers. And I'm working with some of them actually trying to implement health impact assessment and also bringing in indicators for healthy planning. Because one problem what we found here is, for example, in new planning developments, there are a lot of boxes the planners need to tick, but none of them were actually related to health. And so they wanted to put also in the planning permission a short checklist that for indicators for health. So we've been developing with them also this list of indicators.
All right, I think this is a quick one, so I'll just ask it myself. Would you consider sharing your slides after the presentation?
Yeah, sure. Where do I send them to you or?
If you do, I'll post them on the college website.
Nice.
So yeah, we'll make sure they're available on the same link that people could access the seminar on. So the next one, I'm going to open up to Marcel van der Schoot. Apologies for pronunciation.
Oh, that's fine. I'm used to that. No problem. G'day, Mark. Thanks for the presentation. I just wondered if you could comment about the application of low emission zones in Europe. Not so much to get rid of cars, but to actually centre the conversations around the things you were talking about before, about planners, Are they? Do you see them as useful?
Yes, there have been quite a few low emission zones introduced, but I'm not sure that they've always been so beneficial. They raised a lot of political upheaval and a lot of resistance, and there's been a lot of discussion. Also here in Barcelona, we recently introduced one, and it took years to actually get it done. But the impacts are very, you almost don't see anything in terms of air pollution as far as I could tell. It's not my favorite measure, to be honest. And the idea behind it is good. I think also here in Barcelona, it keeps out 10% of cars, particularly the old cars. And so it should have a benefit, but we don't see it as such in the air pollution levels. They're also affected by many other things. So, for me, it comes down, I think a more effective measure is trying to reduce car use and use the space for better things. And that's why I like more the urban changes in urban models, like going to car-free, going to the super block, going to the 15-minute city. I think these are kind of, for me, more appealing measures than the low emission zones.
Right, I think we've only really got time for 2 more questions. Peter Langman.
All the way from Sweden.
Yeah, it's Peter Youngman. I'm an environmental epidemiologist at the Karolinska Institute in Sweden. So Mark, thank you so much for your nice presentation. And I agree with you that active transport like cycling has a lot of potential that needs to be tapped. But there are some issues, of course, depending on geographic location. And being in, for example, Sweden, as the COVID crisis has brought out, there's been a lot of biking. The roads are full of cycles now, and electric bikes as well, which is encouraging. But I start to wonder what's going to happen when winter comes, which it will soon. And the winters are long here. And the snow and the ice covers the streets, and it gets particularly hazardous to bike unless you get studded tires, which it's not trivial. And so biking remains a super option for a number of months of the year for, I think, a lot of people, but there will be some people who cannot bike for whatever reason, or more feeble or elderly that might not be able, especially when the ice hits the road. We need to have alternatives to commute then as well. So
yeah, thanks, Peter. I think it's a good point, and if you look to Denmark, for example, to Copenhagen, I think there's a similar situation, but people keep cycling even in the winter. And I remember going to Copenhagen in February. It was snowy and I was freezing my butt off, and I still saw people cycling around us. I still have this picture in my mind for a father with a little kid at the back of his bike cycling. I don't know how they did it. The kid was just looking around and very happy in between all the snow or whatever. But I think it also gave me an example that, or an idea that it's possible. But also, as you know, for example, in Copenhagen, they prioritize cleaning the cycling paths before the main road. So they solve the cycling paths before, they make them safe before they do the roads. And so they really, because 50% of the trips in Copenhagen are by cycling. And so they want to keep it safe. And so they make actually a really big effort in doing this. And I think we should take that as an example for other places like in Sweden. I've seen the same in Finland. I remember going up to Finland. Also there, the cycling paths were all clear. And also there, they prioritized cleaning the cycling paths before the main roads. On the main roads, the cars had the winter tires, but you don't have them for the bicycles, or as far as I know. But it's a big issue, and I think it comes down that you need to make a real effort to get the people cycle. First of all, you need to have cycling infrastructure. You need to put it on the top of the pyramid for your planning, not at the bottom, what's often done. So you need to make sure that people can cycling. There's a cycling network for people to go, and then also that you maintain it well. As for the elderly people, I mean, what we've seen, in particular for the Netherlands, is that a lot of the elderly nowadays are using electric bikes, and that seems to help them. Even my own dad, who's 86, is still cycling on his electric bike. The problem there seems to be that they sometimes go a bit too fast because they are so powerful, the electric bikes, and that creates sometimes some accidents. So probably they need to put something on there to limit the speed. And also the electric bikes, what you see in the Netherlands, also help against the windy conditions, because, you know, people always say from the Netherlands, oh, it's flat, it's easy to cycle, but they forget it's also very windy. And that makes it almost as difficult as in a hilly environment to cycle. So, you know, the electric bikes there can help as well.
Yeah, thanks a lot. I think you're right. I mean, I think there's a lot of, it needs to be prioritized, need to be financed and thought through. So, and maybe, you know, three-wheel bicycles might be something for people who have, you know, balance issues or something like that. I see a lot of those also on the streets now. So it'll be interesting to see how when winter comes here, how with this new crisis, how much it will push us forward.
Yeah, no, I know the winters are quite severe in Sweden. That's one of the reasons I live in Barcelona. A bit milder here.
Thank you.
But, you know, one of the things is that it's actually much cheaper to maintain or build cycling infrastructure than car infrastructure. It's incredibly expensive to put in roads. I mean, people tend to forget how much money we spend in building infrastructure for cars. I think the cost of cycling infrastructure, it's 10% or 20% for the same kind of amount of what you do. And but it's often forgotten. You know, we're happy to pay taxes. We don't ask where do they go to. Why do we spend them, you know, on building car infrastructure that's super expensive? We just accept that it's there. And I think as soon as we start also looking into the cost for this, and also in the environmental, the health impacts, etc., it becomes clearer that we might not always make the right choices, in particular in cities. You know, I'm talking here about cities. The rural environment, I think, is a completely different ball game. I mean, it's difficult not to get not around by cars, but, you know, in cities, normally you have enough density to have other forms of transport.
Thanks.
It's the comment regarding the costs and analysis of where our tax money goes towards major projects is particularly relevant at the moment. There's a lot of stuff in Melbourne coming out about the Westgate and the Northeast Link with the cost-benefit ratios not stacking up. Last question, and we've run out of time. So very last question, Rohan Burns.
Hello there, Mark. It's very nice to hear your presentation and do much appreciate it. I'm a part-time amateur climate scientist in Canberra. So yeah, most interested to look at those perspectives. But my question relates specifically to the concept of if there is a merit in a country like Australia with its big distances to implement some kind of vehicle transition policy and possibly ban most diesel vehicles. So trucks can run on petrol and battery now, and there's plenty of hybrid options. I know Europe's pretty advanced and there's lots of bans going on there for diesel. They haven't even standardized at Euro 6 here. That's not for delivery till 2027. So I was just interested in your comments, what your perspective might be on that for Australia.
Yeah, no, certainly I think what we need to get rid of the fossil fuels and then go to more electric vehicles. I think the battery technology is improving rapidly. Prices are coming down like crazy. I mean, I see reports that it's nowadays already cheaper to drive electric car than a fossil fuel car. And that's not even taken into account the externalities. The other thing is what you see also more is fuel cells, hydrogen. I mean, what can be in particular for long distances and for trucks, a possibility as well, I think. But yeah, I mean, it's, you know, it comes down to how do you change your energy system. I think in Australia, there's still a lot of mining going on. There's a lot of coal. There's a lot of whatever you have there. but also you have sun that is not always used in the best way, I think, and it needs to have a change. Unfortunately, the whole issue is polarized. You know, if you're on the right, you just keep digging. If you're on the left, you want to do something different. And we need to come together and say what's going to happen. But my guess will be, because of the economic, the cost at the moment for producing energy, it's becoming so cheap for solar power and also with battery technology, that we're quickly moving towards that because of the low cost, the lower costs that are involved.
Thank you so much, Mark. That was fantastic. To everyone that's listening, we have these seminars quite regularly. Please keep looking at our website. We're an interdisciplinary college, so we have all things related to climate, from social sciences to water to urban planning and how to use that sun and turn it into renewable energy. So please have a wee look through. If this topic today was of particular interest to you, since you've signed in, we have a similar one coming up on the 22nd of October. Professor Simon Kingham from New Zealand will be talking a little bit more about urban development and some of the social benefits of a community bump. So sign into that. I've heard him speak before, and he's brilliant. Mark, thank you again.
I love Simon.
Yeah, he's fabulous. Well, I thought it was a good run-on after your presentation. So,
oh, by the way, can I say happy birthday to Billy? It's Billy's birthday today, Billy Giles Scotty. She can't make the seminar, but I just would like to say happy birthday, Billy.
There you go, fabulous. Hope you've had a good day, Professor Corty. Thanks again, and take care, everyone, and we'll see you next time. And yeah, thank you again, Mark, for taking the time in Barcelona, sunny Barcelona, where you have your freedom and your bicycle, to give us a little bit of inspiration here in Melbourne and across Australia. Thank you very much.
Thank you so much, Claire. All the best. Have a wonderful evening. Ciao.
Bye.